Shall we? It's 7:30.
We are live now, doctor.
Okay, 1 minute. Let me share the screen. So, good evening, friends, and welcome to this fourth quarter final of season 5 of Big Q. Well, this is a pan-India intercollegiate quiz for postgraduates across the country, hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, and that's the Big Q for you. So this is the familiar term which must be hearing and yours must have been quite familiar since last 4 seasons.
छोड़ छाड़ के सारे चंपर हट समंदर अपना पर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे चंपर खोल दे पर खोल दे पर खोल दे पर खोल दे पर
Okay. I think, yeah. So good evening, friends, and my pranam to all the mentors. Well, Brain Teaser team welcomes you to this fourth quarter final of this fifth season of Big Q. Well, friends, to the people who are naive and new to this platform, Brain Teaser is an online platform which has been hosting quiz for ophthalmologists of our country since last 6-7 seasons. It was 4 years back. We thought that we should have all the postgraduates from across the country on a single platform, and with that intention, a Big Q was born. We have in general total about 340 institutions offering post-graduations in ophthalmology, be it MS or DNB. We are very fortunate this year we had 250 plus teams who had registered for this particular round. And now we are into the quarterfinal stage where 80 teams are playing the things. So my sincere most thanks for Ophthalmological Society of Nagpur for asking for being with us since last 3 seasons. My sincere most thanks to Dr. Shamik Mokadam, who is the president of Ophthalmological Society of Nagpur, for associating with Big Q team. Well, friends, we in this fifth season we had 6 preliminary rounds. This is the fourth quarter final. So what we have in future is just next 2 semifinals and 1 finals. Well, these episodes were aired on alternate Wednesdays at 7:30 p.m. and so would also be our next first semi-final, which would be 2 weeks later. Brain Teaser is extremely thankful to Quizmaster who toil hard to create such a wonderful learning along with some fun. Today's episode, we have Quizmasters Dr. Anita Venugopal, who is currently Head of Cornea and Refractive Services at Arvind Eye Hospital, Tirunelveli. Welcome, Dr. Anita, ma'am. Dr. Sharmina Devi, Professor at Government Medical College, Vellore. Welcome, Dr. Sharmila, ma'am. And our own Indian, but now an Englishman, Dr. Prashobh Moham, who is a consultant cornea and refractive surgeon at in Leeds, UK. So welcome, Dr. Prashobh, and we are sincerely thankful and absolutely indebted to you for every time participating in this quiz, whether you're in India or abroad. Well, money maketh the mayor go is an old saying, and we are extremely indebted to the team of His Highness, Mr. Suryanarayanan, Mr. Naresh, and Mr. Kaustubh for supporting this episodes since last 2 seasons. Also, I would fail in my duties if I don't acknowledge the field force of His Highness, who made such a massive effort to enroll all the postgraduates, almost more than 250 teams from across the country. Well, online platform needs a smooth and flawless execution, and we are extremely thankful to Numerotech and team headed by Mr. Sai for such flawless execution year after year. And last but not the least, my own colleague and my co-host, Dr. Shilpi, who will be now familiarizing the whole team, for all the teams with the rules of the game.
So thank you, sir. So welcome all to the last quarter final of this season. So this is quarter final 4. So we are back with new 21 teams. So let's see what is the format of quarterfinals 4. So in total, we had 4 quarterfinals, 21 teams in each quarterfinal. So today is the last quarterfinal, and first semi-final will be after 2 weeks, that is on 29th of April at the same time at 7:30 p.m. So for teams, you need to log in through 2 devices for Kahoot and Zoom platform. First screen is the live quizzing on the Zoom platform, and one round will be face-to-face only for the teams with the quiz masters. While the second screen is the Kahoot for the MCQ round, and you need to answer the MCQs on this platform, and this has to be used by both the audience and the teams. I request all the mentors to log in from the separate screen only on the Zoom platform. So out of the 21 teams, 5 will qualify for the semi-finals, and the criteria is the respective quarterfinal marks plus the total of the best of the 4 preliminary rounds you had already played. So now coming to the rules. So we'll have 3 sets of MCQs. Each set will have 5 questions. There is no negative marking in this round, and you will get 10 seconds time for every MCQ. Now, the second round will be the rapid fire round only for the teams. You will have to answer 5 questions in 30 seconds time. I'm repeating 5 questions in 30 seconds time. For every correct response, you will get plus 10. Every incorrect answer will deduct minus 5 from your account. And for pass, there will be no marks. So if you don't know the answer, just say pass. And if the time permits or the time is remaining, you can go back and answer that question later on. So just say pass if you don't know the answer so that you can at least attempt all the 5 questions in 30 seconds time. Teams who are not playing today's quarter final, you can play as audience in private practitioner category, but just remember to write PP before your mobile number so that we can identify you as a private practitioner, not as a PG, not in the PG category. So these are the prizes for the postgraduates in the finals, while we have the audience prizes per episode. So with this, I invite our first quiz master, Dr. Sharmila Devi, who is Associate Professor at Government Medical College, Vellore. She is a postgraduate teacher and cornea faculty with 15 years of experience. She is a phacoemulsification trainer and keratoplasty trainer for many ophthalmologists across the state. She is the winner of the All India Ophthalmic Quiz conducted in AIS Kolkata in 2016 and won many cash prizes in 2018 and 23. She is a past editor of DOAJ Index TNO Journal of Ophthalmic Sciences and Research and has many indexed publications to her credit. She is the past joint secretary of TNOA. She had participated in various short-term surgical programs on ocular surface conducted by LVPI Hyderabad. So with this, I invite Dr. Sharmila ma'am for conducting the quiz.
Good evening, Dr. Shilpi. Thank you very much for the kind introduction. Big Q is getting bigger and bigger. And first of all, I would like to congratulate the 84 teams which have made it to the quarterfinals. So thanks to Prashant sir and Dr. Shilpi for making it bigger and bigger for the past 6 seasons. Shall we go ahead with the questions? Are the teams ready? So shall I go ahead with the questions, Dr. Shilpi?
Yes, ma'am.
So first we have an investigation. So it's an anterior segment OCT. What is the clinical condition shown in this anterior segment OCT, and what are the agents used in the treatment of this condition? So we have the choices. Is it SF6? Is it AIR, C3F8, or can we use all of the above? And your time starts now. So the correct answer is all of the above. So it's a Descemet's tear. You can see the DM detachment on the anterior segment OCT, and all of these are tamponading agents which can be used for descemetopexy. When we use air, it's called pneumodescemetopexy. The other two are used for long-term tamponade, but there is always a risk of pupillary block glaucoma with it. The answer is all of the above. Hope you got it right. So can we go to the next question? So you see a preoperative picture here, a corneal topography and a postoperative corneal topography, and there's something being done on this cornea. You can see something being done on this, it has been done on this cornea, and you can see the postoperative result here. So identify the procedure done. Is it Intacs? B, LASIK? C, C3R? Or is it CARES? And your time starts now. So the answer is, you can see a preoperative steepening of cornea here. It's an asymmetric bow tie with inferior steepening. So that's a keratoconus case. And you can see some flattening on the postoperative corneal topography picture. So this innovation is from Chennai, from Dr. Susan Jacob. So that is CARES technique. You can see the segment here. It's a corneal allogenic intrastromal ring segment. It's a smile tissue which has been used for the corneal allogenic intrastromal ring segment, and the risk of rejection is very less when compared to Intacs. Next question. So all are glaucoma drainage devices except is ACPST, Ahmed Shan, or is it the oral aqueous drainage implant, Monaco? D is Hydrus. So you have to, it's like a neat question. It's except, so you have to figure out which is not the glaucoma drainage device. So the answer is, so all of them are glaucoma drainage devices, and minimally invasive glaucoma drainage surgeries are getting popular and popular. So one of them is not, it's Monaco is for monocanalicular silicone stent for lacrimal duct obstructions and canalicular lacerations. So this is one, this I borrowed from the Tamil Nadu Journal of Ophthalmic Science and Research, this picture. So you can see all the minimally invasive glaucoma drainage devices here. You can see the Audi, you can see the Hydrus and the Ahmed ClearPath. So these are all MIGS, and this one is a monocanalicular silicone stent. So AI has been incorporated into every field, and like it's causing a big revolution. So it is there in ophthalmology as well. So identify the first generation autofocal IOL, which has been called the world's first IOL with artificial intelligence. Can we have the choices, please? Is it Helena, B. Olina, C. Rainer, or D. Sapphire? The time starts now. So it's an artificial intelligence incorporated IOL, meaning AI has been used in the IOL formulas, and so better precision and lens dysphotopsia is very less. So it is a Rainer, that's the first IOL with artificial intelligence. So we see a clinical picture here. There's something on the ocular surface. So what are the choices used in the management of this condition? So all of them can be used except. Again, there's an except question. So can we use mitomycin C? A, mitomycin C. B is interferon alpha. C, tacrolimus eye ointment. D, Shields therapy. So all of them are used in the management of this condition except. The time starts now. So it's an ocular surface squamous neoplasia, and we commonly use interferon alpha and mitomycin C. And Shields therapy is Shields excision, the different steps of excision given by Shields. Tacrolimus eye ointment is used more in vernal keratoconjunctivitis, and this is an ocular surface squamous neoplasia. So that's the answer. I think we come to the end of round one. So we move on to rapid fire questions by Dr. Anita Venugopal. She is the head of cornea and refractive surgery in Aravind Eye Hospital, Tirunelveli, and she's done a research scholar in the University of Michigan. So 15 plus years of experience in cornea procedures, and she has 120 plus peer-reviewed publications. She is a reviewer in American Journal of Ophthalmology, Cornea, and many international national journals. Her focus is on keratoconus, Down syndrome, and ocular surface disorders. Currently, she's working on a CARASCAN device, eye rubbing monitoring device, tear biomarker study for early detection of keratoconus and Down syndrome. Over to you, Dr. Anita.
Thank you, ma'am. Thank you for the kind introduction, and thanks to Prashant sir and Shilpi for having me here back again for this Pan India Inter Collegiate quiz. So, Shilpi, shall we begin with the rapid fire?
Yes, ma'am.
For
Yes,
the
ma'am.
team one.
So
or
the team one is Team Ocular Oracles from Basaveshwar Medical College, Gulbarg. Are you there?
Yes, ma'am.
Yes.
Hi, all the best
Thank you, ma'am.
for rocking this rapid fire round now. So let's begin.
Yes,
Don't worry, I'll start easy. Don't worry. Okay. So the first question, Shilpi.
Ma'am, please introduce yourself, beta.
Hello, ma'am. This is Manasa, third year PG. And this is Suprita.
Okay.
Hi.
So are you ready?
Yes, ma'am.
Yes. Shall we start?
Yes, ma'am. Yes, ma'am.
Just remember, if you don't know the answer, say pass. Okay. Or you know, if you know any of the answers, just you can say the answer to this question number is this. Okay.
Okay, ma'am. Yes,
And
ma'am.
loud
Time
and clear.
starts.
Okay.
Yes, ma'am. Yes, ma'am.
Yeah, the first question. Who explained optical principles of stenopic spectacles first to recognize hypermetropia and gave convex lenses for aphakia?
Pass.
Which phase of clinical trial deals with safety and effectiveness of an ocular drug in humans?
Ma'am, phase 3. Phase 3.
Most common initial symptom of acute endothelial corneal dystrophy?
Early morning pain.
Name the smallest anti-VEGF molecule?
Besi.
Time's up, I think.
It's okay. You can attempt the fourth question.
Yeah. Okay.
Besi. I am not able to pronounce. Bevacizumab.
Okay.
Fourth one.
Okay, try the fifth question. 34-year-old man with a progressive vision loss in the left eye for last 3 days. So what is the diagnosis? So think that it's infectious and just unilateral. What do you think?
Near the macula toxo.
3 days history and progressive loss.
Okay. The time is up.
Yes, ma'am. Thank you.
What are the answers?
So answers for the first question, who explained the optical principles of stenopic spectacles and the hypermetropia and gave convex lenses, the Benito Daza D. Valdez.
Oh.
Yeah. So the second question on clinical trials. So phase 1 is for safety. So phase 2 is safety and effectiveness. So most common symptom, you were nearly correct, but you said pain, but it is morning blur because of the overnight corneal edema that happens.
Corneal edema, yes.
Yeah. And then the smallest anti-VEGF molecule. This is Brulizumab.
Yeah.
So because it is important for better tissue penetration. And the last question is diffuse unilateral subacute neuroretinitis. So you have to suspect this in an unexplained unilateral visual loss. Good.
Okay. Yes.
So
Plus 10, minus 10. Matlab 2 wrong and 1 right. So
0. Okay, ma'am.
0. Okay. Not an issue.
Okay.
Great. So the next team is The quiz waves from PGIMS Rohtak. Are you there?
Yes,
Yes, ma'am.
Good afternoon, ma'am.
Please
Good afternoon,
introduce
ma'am.
yourself. Yeah.
Ma'am, I'm Dr. Apush and
Ma'am,
this is Dr. Rajat.
Dr. Rajat, PG3.
Hi, welcome to the quiz. So all the best for the rapid fire round 2.
Thank you, ma'am.
Thank you.
Be closer to the mic and be fast.
Yeah,
Okay.
be loud and clear also.
Yes, ma'am.
Yeah.
Okay, ma'am.
The time starts now.
So who was the first to introduce iris fixation of intraocular lenses?
Pass.
Lifitegrast 5% is a lymphocyte function associated antigen antagonist used in treatment of which ocular condition?
Pass, ma'am.
Decimate membrane is derived from?
Ma'am, third is neural crest cells.
Yeah. A bag contains 10 black and 20 white balls. A ball is drawn at random. What is the probability that it is black?
33.
33%.
Okay.
So you want to attempt the fifth question?
Yes, ma'am.
Yes, ma'am.
24-year-old with
Gomori.
redness in right eye and scraping.
Fifth is Gomori methamine.
गमोरी मिथामाइन फर्स्ट क्या पता है हाँ कैलमन मैम फर्स्ट का क्या
First का मैम आंसर करना था.
Bolo.
Can we answer the
You will not get the
first
marks
question?
because it is after the time, na? But you can attempt.
कैलमन
We can't hear you.
कैलमन
No, your voice is not clear.
I'm Calman.
कैलमन
Okay.
Strong.
Ma'am,
कैलमन
Calman.
Okay, let's see what are the answers.
Yeah. So the first question, who introduced iris fixation of intraocular lenses? It is Cornelius Bing-Cross, 1959. Very important in the evolution of IOLs. And lifitegrast is used in dry eye syndrome, 5%. So think of like it is an inflammatory, anti-inflammatory, so ocular surface. So you have to think like that. Then decimate membrane, that is a correct answer that you gave, is neural crest cells. And bag contains 10 black and 20 white balls. Ball is drawn at random. The probability is 1/3. So black balls in total balls, that is 1/3. Don't like overthink in this. And 24-year-old and the corneal scraping and stain that is used is lactophenol, a cotton blue stain for acanthamoeba keratitis. You have to think like this. There is a clue here. Pain and redness. So pain would be disproportionate to the signs. So think of acanthamoeba and then you will come up with the stain. Okay.
So
Well
when they passed 3 and 2 were correct, so plus 20 to them.
So they gave the fourth one was correct.
Fourth one was
Yes, ma'am,
correct. They
it's
said 33%, ma'am.
Okay. So
Yeah.
sorry, I didn't follow that. Okay.
Yeah. So third and fourth is right.
Okay.
First they answered wrong, but it was after the time. I clearly told
Oh.
them you will not get the marks.
That's okay.
Okay.
Thank you, ma'am.
Well played, team 2.
So
Thank you, ma'am.
Good adapts. Yeah.
the
Good.
next team is the Iconics team from IGIMS Patna. Your voice is breaking.
Hello, am I audible?
Yes.
Yes, ma'am.
Please introduce yourself.
I'm Dr. Anshuman, ma'am, final year JR in RIO, IGMS Patna.
And your partner?
My partner, unfortunately, is not here, ma'am. She's out of town. She's not in Patna.
Okay. Check.
Single-handed. Okay. Let's see. All the best. Who was the first to perform triple procedure, like cornea and cataract surgery in history?
Pass.
Which is the drug of choice for acanthamoeba keratitis? Very important.
Yes, ma'am. Pass.
On POD1 after cataract surgery, a patient develops diffuse keratopathy and corneal edema. Which investigation will be the best guide for further management?
ASOCT.
Yes. Which design involves analyzing a single sample without a comparator? Which design involves analyzing a single sample without a comparator?
Okay. So you want to attempt the last question? You will not get the marks, but you can attempt.
35-year-old with a transient blurring of vision associated with headache. What is the probable diagnosis? It's
Are you
just
there?
transient blurring of vision, 35-year-old with headache. That's all.
Pass.
So transient visual obscuration is okay. So coming to the answers, suspect to perform triple procedure is DM Taylor. And what is the drug of choice for acanthamoeba? It is PHMB 0.02 or 0.04% with chlorhexidine. And POD1, this was right, and the segment OCT. And which design involves analyzing single sample? That is single sample and there is no comparator. That the design is one group study. Very common in early observational research. So,
Okay,
and
okay.
35-year-old with a transient blurring and with headache. So this is papillary edema. There is always remember that whenever there is a transient visual obscurations, it indicates raised IOP and otherwise. Hello?
Hello.
Yes, ma'am.
Yes. Okay.
Okay.
So Shilpi, like
They passed 4 questions and answered only the
third one. Yeah.
So plus 10 to them.
Okay.
Yes.
So they've got plus
10.
good.
So the next team in line is Team Retina Visioners from RIO GOH Chennai. Team Retina Visioners.
Good evening, ma'am.
Good evening. Please introduce yourself.
Good evening, ma'am. I'm Amrita and this is Harini. Finally, yes, ma'am.
Welcome and all the best.
Thank you, ma'am.
Can you be closer to the mic, please? Yes. Shall
Is
we
it
start?
fine now, ma'am?
Shall we start?
Yes, ma'am.
Okay.
Who described the clear corneal incision for cataract surgery?
Pass.
Which anti-VEGF agent binds to VEGF-A and PIGF? Dual binding agent.
Faricimab.
Help algorithm used in the management of desmus membrane detachment. Fast.
Pass. Fifth question, Graves, ma'am. Exophthalmosis, thyroid eye disease.
Amount of variation or dispersion in a study is measured by? So attempt this question. Amount of variation or dispersion in a study is measured by? In a study, that variation or dispersion is measured by what?
Pass.
50-year-old female smoker with a normal thyroid function. Most probable diagnosis is?
Graves, thyroid eye disease. Exophthalmosis.
Are you talking amongst self or are you answering us?
Answering only, ma'am. Sorry, ma'am. We were answering only, ma'am.
No, you were not answering. You were continuously talking with each other. Even madam was asking the questions and you were talking with each other. Okay, let's see what are the answers.
So clear corneal incision was described first by Howard Fine and anti-VEGF agent which binds to both VEGF-A and PIGF. A dual agent is alfibercept, and help algorithm is for height, extent, length, and pupil. And the amount of variation is the standard deviation. And 50-year-old female smoker with a normal thyroid function. Probable diagnosis is thyroid associated orbitopathy. And TAOs occurs with a normal thyroid function in 5 to 10% of the patients.
So, ma'am, they answered only one question, that is second, and that is wrong. So it's -5 to them.
Fifth question also.
Fifth question you answered well after so long time. Matlab,
Ma'am,
after
before, no, ma'am, while ma'am was asking the fourth question, that time we told fifth question answer, ma'am, actually.
No, you should say, if you don't know, you should say pass. Then I will go to the fifth question so that you can answer the fifth.
Okay, ma'am.
Yeah,
Okay.
that is how we are doing it.
Okay.
So the next team is team NS3 from KLE Belgaum.
Hello, ma'am. Good evening, ma'am.
Good evening.
I'm Dr. Rohan.
I'm Nivedita, ma'am.
We are final year PGs, ma'am, from KLE Belgaum.
Welcome and all the best.
Thank you, ma'am.
Shall we start?
Yes, ma'am.
Yes, ma'am.
Who first performed successful extracapsular cataract surgery?
Yes, sir. Yes, ma'am.
Which pharmacokinetic property causes loteprednol to have a lower risk of IOP rise?
Ma'am, fifth question is bleph failure.
Honeycomb epithelial. No. They have to go in order. Honeycomb epitheliopathy is known side effect of which class of topical drugs? Come on, fast. All these are easy questions.
Ma'am, third question, row kindness.
Fifth question is bleph failure, ma'am.
Okay. And the fourth one?
Fourth one?
Pass.
Pass, ma'am.
Okay.
So first successful extracapsular cataract surgery by Jacques Daviel and loteprednol. It undergoes rapid ester hydrolysis to inactive metabolites. That is the reason for it to have a lower risk of IOP rise. Honeycomb epitheliopathy by Rho kinase inhibitors. And p-value of 0.03, assuming the alpha level of 0.05. So null hypothesis is rejected. And first day post trap 46 IOP and patent PI. So most likely causes malignant glaucoma. No, aqueous misdirection. Central AC is also flat in malignant glaucoma.
Okay. Thank you, ma'am.
They answered one correct, ma'am, third one. And the fourth was wrong. So it totals to +5.
So what did they answer for fifth question? What was it? Bleph failure.
Bleph failure, ma'am.
Bleph failure will not occur on the day one.
Okay, ma'am. Sure, ma'am. Thank you.
Thank you. Okay.
So over to Dr. Prasho Mohan. He has done his MBBS from Dr. SMC SI Medical College, Karakonam, Thiruvananthapuram, and MS Ophthalmology from RIO Trivandrum, Fellowship in Cornea and External Eye Diseases from RIO Bangalore, and FRCS Glasgow and FRC Opthal. Worked as a consultant cornea and refractive surgery in several of the large tertiary eye care centers in Kerala and served as a medical director of Eye Bank Association of Kerala and Swarnam Eye Bank and Ananta Eye Bank. Moved to UK in November 2022 as a refractive and a cataract surgeon with Optical Express. From May 2023 to present, working as a consultant with subspecialty interest in cornea at the Northern Care Alliance NHS Foundation Trust. And he's leading the cornea subspecialty in that trust. Sir, over to you, sir.
Hello, thank you for that kind introduction. Am I audible? Am I visible?
Yes, sir. Yes, sir.
Right.
So yes.
Right. It's great to join the PQ again. And the rules have been explained already. And I think we're going with team 6.
Yes. So just again, I'm insisting that if you don't know the answer, please say pass. We are seeing that during this quiz, teams are interacting amongst themselves more than they are involved in answering. Even if we are telling the answers, you are not listening to the quiz master. These are the not only for this quiz, but these questions will help you in your future also. So just try to listen what the quiz master is explaining.
Right. Okay. So I think we have a precedence right now. So we should be answering questions in order. and wait for the quizmaster to finish the question. Or if you don't know the answer, just say pass. The quizmaster will obviously move to the next question
Yes.
and so on. Yeah.
So the next team is Team Netra from Chaitanya Eye Hospital, Trivandrum.
Hello, good evening.
Hello, can you
Good
hear
evening.
me? And
Good evening, sir.
check your
Yes,
mics?
sir.
Right, great. So we are going with the questions now. Team Netra.
Yes,
Please
yes, sir.
introduce yourself. I can't
Sir,
hear you properly.
ma'am, is it audible now?
Yes. Be louder.
Okay, ma'am. Ma'am, myself Anjana. I am a third year resident. Dr. Parvati, third year resident.
Okay. Good.
Great.
So let's start.
Yes,
Right,
ma'am.
we can start. Right, your first question is, who developed the first effective surgical treatment for glaucoma?
Pass, pass.
What is the maximum amount of fluid an eye can hold prior to tearing?
Pass.
What's DSO in cornea? Expand.
Pass. Pass.
The clinical trial in which neither the participants nor the researcher knows which treatment or intervention the
Double
participants are
blind.
receiving.
Double blind.
What is the eponymous pupil sign associated with this condition shown in the figure?
Pass.
Okay.
Right, we can move to the answers. The first effective surgical treatment for glaucoma was described by von Graffe. It was iridectomy. It was way back in the 1800s. The maximum amount of fluid an eye can hold prior to tearing is about 25 to 30 microliters. And DSO stands for decimal stripping only, also known as DWEC, decimal stripping without endothelial keratoplasty. The clinical trial in which neither the participants nor the researcher know which treatment or intervention the participants are receiving is, you answered correctly, the double-blind study. And the eponymous pupil sign is the Hutchinson's pupil. You can see in the neuroimaging that there is midline shift. So the classical pattern of constriction of pupil followed by dilatation on one side, followed by the opposite side is seen in Hutchinson's pupil. So I think they answered one question. Am I right, Dr.
Yes,
Shilpi?
yes. Yes, plus 10 to them. Great.
Done?
Yes. So the next
Right.
team is Team TVL from Tirunelveli Medical College. Team TVL.
Right, Team TVL, you can introduce yourselves.
Are you there? Okay, let's move on to the next team. Next team is Team Foveal Focus from Arvind Eye Hospital, Coimbatore.
Team Foveal Focus, please introduce yourself.
Hello.
Hello.
I'm Sakshi from Arvind Hospital.
I'm Shivam from Arvind.
Be closer to the mic. We can't hear you properly.
Hello.
Yes.
Are we audible?
No, be closer to the mic. You know? Shall we start?
Yeah.
Yes.
Okay.
Right, who was the first to discover corneal application of excimer laser and introduce PRK?
Pass.
Which salt of brimonidine is used as a topical anti-glaucoma medication?
Pass.
Which drug has the most published evidence for accelerating corneal clearance after decimal stripping only in Fuchs dystrophy?
Pass.
In a Gaussian distribution, what percentage of data is encompassed within two standard deviations?
68%.
What are the characteristic electrophysiological findings associated with this condition?
Decreased duration.
What?
Can you please be louder?
Decreased Ardens ratio.
Okay. And electrophysiological test? Mein?
But I think we can give them that. I think we can
We will give
them.
the marks, but I'm just asking, what is
Yeah.
the electrophysiological test which are done to diagnose this condition?
Pass.
What are the two electrophysiological tests you know of any condition?
EOG, ERG.
Yes.
Yeah. So what happens to EOG and what happens to ERG?
ERG is
EOG decrease.
EOG is decreased, ERG is normal.
Very
Great.
good. Very good.
Great.
Right. First question, the person who introduced PRK was Stephen Trokel. And I think you passed the answer, passed the question.
Yes.
Second question was also passed. It's brimonidine tartrate. Third question, I think you also passed. The Rho kinase inhibitors are used along with decibel stripping only. And the fourth question, I didn't exactly catch your answer. Did you say 58%?
No, we
Yes.
said
67%,
67.
they said.
Okay, so that's not the right answer. It's around 95.4, 95.5% for 2 standard deviations. It's 3 standard deviations would be 99.7%. Right, so that would be a negative mark for you, and I'll give you grant you the last answer. It's a normal ERG, which is a reduced Arden ratio, and normal ERG and an abnormal EOG, which is the reduced Arden ratio, as seen in Best disease. So, Dr. Shilpi?
Plus 5 to them.
Okay, plus 5. Well done.
The next team is Team Cone Heads from Sankara Eye Hospital, Coimbatore.
Hello,
Hello.
are we audible? Yeah, I'm Siobhan. I'm Abita. We're both third years from Shanghai Hospital.
You are at danger of dropping out. It's kind of clear, but not fully clear.
Yes.
Your voices.
Can you hear us now, sir? Are we audible now?
Yes, you are.
Yeah. Yes, better.
Okay.
So, yeah. Shall we start?
Yes, please.
Okay.
Great, here we go. Which book was considered the earliest comprehensive textbook on ophthalmology?
Pass.
What is the source of chondroitin sulfate in dispersive viscoelastic?
Shark fin. Shark fin.
Caterpillar hair
Next
in the
question.
eye is called?
Pass. Bias.
Bias, which occurs due to duration of time between detection of the disease and its usual clinical presentation and diagnosis.
Temporal.
Name the stain
Pass.
used to identify this condition in histopathology.
Pass. Periodic acid. Pass. As in periodic.
Okay, no, you didn't say pass, you said PAS, yes?
PS.
Okay.
Achha, that
Right.
pass. Okay.
Periodic acid chips. Periodic acid chip.
I mean, you would have loved it if I thought it was PASS.
Yes.
Let's go to the answers. Yeah, so the first book or comprehensive textbook was written by Ali ibn Isa al-Khalal. It was called Tadkirat al-Kahalin. It basically means a notebook of an oculist. It was way back in Baghdad, I think, in between 940 and 1000 AD. Right. So the chondroitin sulfate, you answered it correctly as shark fin. You can give marks for that. Caterpillar hair, I think you passed.
Yes, they
The
passed.
right answer is
Yes, sir.
ophthalmia nodosa. Bias, you said temporal bias. The right answer is lead time bias. I'm not entirely sure if temporal bias is another term for it, but it's not there.
Anita ma'am can guide us.
You're trying to say like time associated.
Anita ma'am?
I think temporal bias is basically taking too much time. It's not exactly the same as lead time. That would be my assessment. We can't give you that.
And the last one, they said
The,
pass.
the last one, you should have passed it. But the answer is
Was it a
nice
time
and
up
cycle.
for that one? I think the time was up
No,
for
no,
that
no,
one, sir.
no.
I'm sorry. I mean, I was trying to give you time for that, but
Okay, thank you.
right.
plus
So that would be
minus
my.
10.
Sorry for that. It's slightly unlucky, but yeah. But well done. Good attempt.
So let's move on to the next team. So the next team in line is Team Asteroids from Vishakha Eye Hospital, Vishakhapatnam.
Yeah. Good evening, ma'am. Good
Good
evening,
evening.
sir. Myself, Sri Navya. This is
I'm Shiva Parvati, sir.
we are
from-
second year DNBs from Vishakhapatnam Hospital.
Welcome. Welcome to the quiz. And pardon me for the sounds of crackers in the background. I can't do anything about it. Sorry about that. Hope you can hear me clearly.
Yes,
Yes, sir.
Shall we start?
Yes,
Yes.
Okay. All the best.
Right. Who coined the term dendritic ulcer?
Pass.
What chemical class of drug does benzalkonium chloride belong to?
Pass.
Pass.
The isoexpansile concentration of SF6 is?
16%.
What does a Carl Pearson's correlation coefficient of minus 0.1 suggest?
Pass.
The 59-year-old female with chronic bilateral conjunctivitis, how will you investigate? Look at the pictures, please.
Ocular cicatricial pemphigoid.
Ocular cicatricial pemphigoid, we'll go for ASOCT and biopsy.
Biopsy.
Biopsy what?
IgA, that fluorescence, linear deposits of the IgA fluorescence.
What do you biopsy?
Sir, in the conjunctival.
Right. Okay, I can give that to you. You finally got
Yes.
it. Right. The dendritic ulcer was coined by Hansen Groth. He's a Danish ophthalmologist. Benzalkonium chloride is a quaternary ammonium compound. The isoexpal concentration, unfortunately, is 20%. You answered 16%.
Her range will come.
No.
The range is 20 to 25.
Yes, exactly.
Okay.
Unfortunately, it's not the other way around. What does a Carl Pearson's correlation coefficient? Did you pass that? I think you
Pass.
Yes.
yes, you did pass that. I suggest a weak negative correlation. And conjunctival biopsy is the right answer for OCP. And yeah, I think you answered it correctly.
Yes.
You can give the marks for
Plus 10 minus 5. So plus 5 to them.
that. Good
Thank
attempt.
Okay. So the next team in line is Team Focus from Chaitanya Eye Hospital, Trivandrum.
Focus, please introduce yourself.
Team Focus. Are you there? Okay. So the next team in line is Team Crazy Amsler from Government Hospitals, Kakinada, Andhra Pradesh.
Ma'am, we are there.
Which team?
Focus.
Okay. Okay. Great.
Right. So Team Focus, yeah, please introduce yourself.
Myself, Dr. Pooja. I'm Aisha.
Right. Are you ready to go?
Yes, sir.
Okay.
Yeah.
Be closer to the mic and be louder.
Right. Who recommended the use of 20% mannitol for IOP
Pass.
reduction?
Pass.
What percentage of natamycin is used as an eye drop?
5%.
Why are alkali burns more dangerous than acid burns?
pH. Pass.
Which test is suitable to compare whether compliance with glaucoma medication differs between patients less than 60 years of age and older patients?
Pass.
30-year-old woman with IOP of 36 millimeters of mercury in the left eye, the right eye is within normal limits. What is the most probable diagnosis? Please look at the clinical picture.
Eye syndrome.
Great.
That's the right answer. Let's go for the answers. Yes, 20% mannitol for reduction of IOP was described in 2 different papers by Smith and Drance and by Daniel Weiss, Schaeffer and Weiss in 1962, I think. What percentage of natamycin is used as an eye drop? You answered that right correctly as 5%. Alkali burns are more dangerous because they cause liquefactive necrosis and they penetrate more deeply. And acid burns cause precipitation of the proteins and therefore they don't penetrate as much. You did not answer that. Which test is suitable to compare compliance with glaucoma medication between patients less than 60 years of age and older patients? The answer is the chi-square test. And the IOP question, you have answered it correctly. You looked at the image and the specular microscopy, it is the eye syndrome. So, Dr.
Plus
Shilpi,
20.
you get plus 20. Very well done.
Second and fifth. Yes. So thank you, sir. Thank you for this wonderful round. So it's time for a short break. Team focus, please mute yourself. So we thank the His Highness team for the continuous support, and this is a small ad. So remember, friends, we have our first semi-final on 29th of April with the new Quizmaster. So please mark your calendar and save the date. So with this, we move on to the next section of MCQ by Dr. Sharmila ma'am.
Thank you, Dr. Shilpa. It was good to see the teams finally. So we move on to the next question. So an intellectually deficit male child was referred to the OPD with MRI showing an agenesis of corpus callosum, and the fundus examination shows the following finding. What do you suspect? Look at the fundus picture. What do you suspect? And these are the choices. Is it Leber's hereditary optic neuropathy, Aicardi syndrome, Treacher-Collins syndrome, or demosia, or septoptic dysplasia? So which one is it? And your time starts now. So the answer is D, demosia syndrome. So a male child, midline defects, corpus callosal defects, and optic dysplasia, optic hyperplasia can be there in Aicardi syndrome also, but it'll be there in a female. LHON, again, you can have visual loss in a male, but then you won't have the corpus callosal defects. So the answer is septoptic dysplasia, demosia syndrome. So you can see a hyperplastic optic nerve. So what you see in the fundus is the double ring scotoma. You can see a optic nerve hyperplasia, and surrounding that you can have the you see the scleral canal. The pigmentation is seen there. Next slide. So happened that all the three quiz masters are cornea specialists, and you must be getting bored with a lot of cornea questions. So here and there we do have some retina questions and other specialties. So following FFA finding in CSCR is an example of what do you see here, and these are the classical patterns. So do you see a hypofluorescence in the window defect, a hyper leakage, a hyperfluorescence pooling, or hyperfluorescence with staining? And your time starts now. So the FFA finding in CSCR can be, they're very, examiners are very fond of this question, smokestack pattern and ink blot, and it's a hyperfluorescence. You can see a very clear border. So it's actually the pooling of dye in the space, and you can have clear borders. If you have ill-defined borders, it can be CNVM. So this is a very clear border. In CNVM, it's called a leakage. Next slide. So you have an anterior segment finding here. You can see it in the slit lamp. So the following anterior segment finding is an indication of which of the following procedure according to the central retinal vein occlusion study. So pay attention to the study. Can we have the choices? So what do they recommend? Do they recommend a laser peripheral iridotomy, a surgical iridectomy, anti-VEGF, or PRP? And your time starts now. So the finding that you see there is a rubeosis iridis. So the question here was CVO study. So we do give an anti-VEGF, but according to CVO study, it is PRP. So the answer is PRP. So only when there is a rubeosis iridis, you go for PRP, according to the CVO study. Next slide. So you see a man here who's given us one of the very important innovations. Some of the most famous innovations have happened in garages, and name the famous ophthalmologist who performed the first procedure on April 20, 1970, which revolutionized an ophthalmic subspecialty. So was it Fyodor, Robert McKeemer, Charles Kelman, or Sir Elliot? And your time starts now. So this garages and innovations, there's something happening there. Steve Jobs came up with an innovation in a garage. So it was Robert McKeemer and his pars plana vitrectomy, which revolutionized the retina subspecialty. And that's the answer. I think we come to the end of round 2. So he's the father of modern, we have one more question. So Robert McKeemer is the father of modern retinal surgery. So here you see anterior segment picture, and it's a case of hemophilia with firecracker injury presented with this clinical picture after 2 months. So what is the likely diagnosis? This picture is a late presentation after 2 months. So what is the likely diagnosis? An anterior dislocation of lens? Is it a blood staining of cornea? Eye drops? Or is it corneal dystrophy? And your time starts now. So here the clue is a hemophilia case, and you can see a suture here. So a paracentesis has been likely done for this case. So it's probably the case presents hyphema initially, and then with glaucoma, it has gone for endothelial damage and blood staining of cornea. So that another DD could be anterior dislocation lens, but these are the other clues given here, hemophilia, and you can see the suture being done there. So some procedure has been done, probably a paracentesis. So it's a blood staining of cornea, and the treatment can be a endothelial keratoplasty or an optical penetrating keratoplasty, because nothing much to do if the patient presents later. We go to the next round of rapid fire by Dr. Anita Venugopal. Over to you, Dr. Anita.
Thank you, ma'am. So coming again to the rapid fire round. So
Yes. Ma'am, I want to confirm 3 teams basically, they are not responding.
Okay.
So is the team Theos from PMCH Patna? Are you there? If you are there, please message me or raise the hand. Team Theos from PMCH Patna. Other team is Team Iconic from Sarojini Devi Eye Hospital, Hyderabad. Team Iconic from Sarojini Devi Eye Hospital, Hyderabad. And the last team is Team TVL from Tirunelveli Medical College. These 3 teams, if you are there, either message me on my personal WhatsApp or just raise your hand. So with this, we move on to the next team, that is Team Vardi 4 dots from RIO GOH Chennai. Team Vardi 4 dots?
Yes, ma'am.
Yes.
Vardi 4 dots.
Yes.
Please introduce yourself.
Camera. Hello, ma'am. I'm Dr. Aishwarya, final year of the PG from ROGOH.
Hello, ma'am. I'm Dr. Harini from ROGOH.
So we don't see your faces here. Doctors?
Sorry, ma'am. There is some issue with the net.
Okay,
Okay. So,
let's start.
Yes, ma'am.
yes.
Okay.
So again, cornea lovers. Who was the first ophthalmologist who described the keratoconus in detail and distinguished it from other ectatic disorders?
Pass, ma'am.
Pass, ma'am.
Which topical anti-glaucoma drug can precipitate corneal decompensation in patients with endothelial dysfunction? Come on.
Ripastudin.
Cause of pain in pseudophakic bullous keratopathy?
A corneal nerve involvement.
Bullous rupture.
Okay.
Okay.
So,
We can give you the fourth question.
yeah.
Venous
So-
case.
Can try. Can they try, Shilpi?
Yes, ma'am. Yes,
Yeah.
ma'am.
To investigate the association between smoking and ARMD, which study design is most appropriate?
Case control, ma'am.
Okay.
Yeah.
So last you can attempt,
What
but
is
we will
the
not
first-
give it to you.
Yeah. What is the first line of treatment? Look at the middle picture and tell us what is the first line of treatment for this? What is this condition first? And what is the
Faint papillary conjunctivitis.
okay? What is the first line of treatment then? Very good.
Steroids, ma'am.
So why it occurs? Like why this condition occurs? Giant papillary conjunctivitis. Usually,
Other
most common.
type of hypersensitivity reaction.
No, what is a common etiology for this? A risk factor for this, getting the patient getting this.
Like burner keratoconus. Many factors are there. Like even VKPs, we can see this, and in contact lens users, we can see this.
Yeah,
ma'am.
very good, very
The
good.
clue is there in the first image.
Okay, ma'am.
First image. Yeah, the third also shows.
Yes.
There is a contact lens there. Okay. So the ophthalmologist who described keratoconus in detail and distinguished from other ectatic disorder, Dr. John Nottingham, and a topical anti-glaucoma drug, carbonic anhydrase inhibitors like dorselamides, they precipitate corneal decompensation. So if they ask you like which will precipitate corneal decompensation, just think of corneal endothelial function. Then you will come to arrive at this answer. Then what causes pain in pseudophakic bullous keratopathy? It is because of ruptured bullae and exposure of corneal nerves. This you got right, I think. And this also, like, but time was out. So whether we can give this?
Fourth, we will give to them.
Yes, yes. Okay. So the fifth one is also right. But third and fourth, I think we can give.
Yes, ma'am. And the second was wrong.
Third, they said exposure of the.
Second, they said rho kinase inhibitors.
Oh, yeah. Second was wrong. Yeah.
Yes. So plus 20 minus 5, it totals to plus 15.
Okay.
Okay.
Thank you.
Good. Congratulations. Good.
Thank you, ma'am.
So the next team is Team Insight from NSCB Medical College, Jabalpur. Team Insight?
Hello.
Yes, please
Yes,
introduce.
ma'am. Ma'am, I'm Dr. Sudhiti.
I'm Dr. Anubhuti.
Welcome, doctors. All the best. So shall we start?
Yeah.
Who was the first to implant intrastromal corneal lenticule?
Pass.
What is the key mechanism of steroid-induced IOP rates? Very important question. Hyperfluorescence that increases in intensity and size in the late phase of fluorescent angiography is termed as?
Pass.
A researcher conducts a study to determine total number of blindness cases in a village on January 1st, 2025. Which measure is this?
Cross-sectional.
It's a cross-sectional, okay, but what he's trying to study, what is the measure?
Incidence.
I'm not asking for a design. No.
Incidence.
So it is total number of blindness cases in the village. I'm not asking for a new cases. That is incidence. So this is total number of blindness that is already there in the village. What is it?
Prevalence of the disease.
Yeah, good. Correct. Prevalence it is. And then 28-year-old women with tinnitus and hearing loss, left-sided neuroparalytic and neurotrophic keratopathy, name the systemic disease. So easy.
You can answer, but you will not get the marks.
Yes.
Let's see what are the answers.
Okay. So the first question, first to implant intrastomal corneal lenticles is Barraquer in 1949. A key mechanism of steroid-induced IOP rise is due to reduced trabecular meshwork outflow due to extracellular matrix accumulation. And the hyperfluorescence that increases in intensity and size in the late phase of FFA is termed as leak. And the researcher that conducts this, you were right. Shilpi, you decide whether to give or not. And for the last question, it is neurofibromatosis type 2 because of the component, the association is vesicular schwannoma.
Okay. I think they answered it incidence first, so we cannot give them the marks.
Okay.
So 4 pass and 1 wrong, so it is -5.
Okay. That's okay, but you attempted. Nice.
Yes.
Yeah.
Yes.
Good.
Okay. So
Okay.
the next team is Team Strebismic Sisters from Sankara Netralaya, Chennai.
Hello. Ma'am, can you hear us and see us?
Yes.
Okay.
Please introduce yourself.
We are clear, ma'am. Audible?
Yes, you're clear.
Okay. Thank you.
Introduce yourself.
Yeah. I'm Swandima and I'm Shamika. We are third year PGs from Shankar Netralaya.
Welcome.
Thank you,
And all the best.
Thank you, ma'am.
Let's start.
Yes, ma'am.
So,
Be closer to the mic.
Yes, ma'am.
who was the first ophthalmologist to introduce epikeratophobia?
No, pass, ma'am.
How does pilocarpine increase risk of RD?
Ciliary muscle contraction.
Type 1 big bubble in dark?
It is separation between deep stroma and DM.
What statistical test is used to compare mean IOP between males and females?
T test. I'm not sure. Next.
Okay.
30 year, you want to attempt?
Yes,
Can
ma'am. Yes, ma'am.
We'll give them.
You?
We'll give them.
What test, statistical test used to compare the mean IOP between males and
Ma'am,
females?
we answered T test for
They
the
answered it. I'm asking about the 5th question. You can
T test
attempt that.
answer. Okay.
Yes.
5th question. 30-year-old male with occasional headache and history of migraine, normal neurological assessment.
papilledema can be papilledema.
It is
Vascular papilledema. Yes. IIH.
Okay. So what you answered for the second one?
Ma'am, we said muscle spasm.
Muscle
Ciliary
spasm.
muscle spasm.
What?
Ciliary muscle contraction.
Ciliary muscle contraction.
Okay. Let's see what are the answers.
So first ophthalmologist to introduce epikeratophobia is Herbert E. Kaufman. And pilocarpine increases the risk of RD because of the anterior vitreous traction. And type 1 bubble is between stroma and the Duas layer. The statistical test is unpaired t-test for a normally distributed variables and Mann-Whitney test for the non-normal distribution. And 30-year-old male with the occasional headache and a history of migraine, it is pseudopapilledema, optic nerve head drusen.
So they answered second wrong, 5th wrong.
Okay.
Third, I think they answered right, ma'am. It is
Fourth also we answered partially.
fourth also. Yes, I'm coming to it. Third, you answered right. Fourth, you answered right. Second and 5th was wrong. So it totals to +10. +20 -10 +10.
Good.
Okay. Ma'am, one team is unable to join on this audio and video cannot be uh, switched on. So I'm taking her. Okay, let me check if she picks up the phone. We can try with her.
Hello.
Ha, team Theos se Dr. Sambhavi. Hello.
Yeah, ma'am. Can you hear me?
Yes. Are you able to see the questions?
Yes, ma'am.
Okay, so ma'am, we will take her quiz on the phone.
Okay.
So yeah. So you can see the question, you can answer. Okay, Sambhavi?
Yes, ma'am.
Yeah. Okay. So your time starts now.
Who first performed successful extracapsular cataract surgery?
Okay. Next question.
What is the systemic side effect limiting acetazolamide use in sickle cell disease? Acidosis, ma'am.
Okay. Next question.
Statistical method used to compare the means of 3 or more independent groups to determine if at least one group mean is significantly different from
Yes.
the other.
Next question.
Name a term for a focal excrescences that appear as drop-like, mushroom-shaped or anvil-shaped protrusions extending backward from the decimal
Okay.
membrane.
The last question we will give you because your questions were long.
60-year-old uncontrolled diabetic, IOP 50. What is the most probable diagnosis? Uncontrolled diabetes. Glaucoma. Neovascular glaucoma, ma'am.
Okay. Okay. Great.
Okay.
Ma'am, she answered first as Jack. I will see the
The
answers.
answers, yeah.
Yeah. First answer, she answered right. Jack.
Yeah.
Second
Second was
answer,
also right.
right, acidosis. Third also right, she said ANOVA.
Okay, I didn't hear
Fourth
this.
also right, she said Gatte.
Okay.
Fifth, she answered it as
Cell.
neovascular glaucoma.
Okay.
Fifth one.
Okay.
So what you said?
Vascular. This is degenerated RBCs that blocks the.
Yes. So
And
last is wrong.
Yeah. So first
She
four
answered
are, yeah.
4 correct, 1 wrong. So it totals to plus 35.
Wow, that's great.
Great, great.
Great. Congrats.
So the next team in line is, just wait a minute. Next team is Team Invincibles from Chaitanya Eye Hospital. Team Invincibles. Okay, the next team is Team Sparkle Spice from Saptagiri Medical College, Bangalore.
Yes, ma'am.
Yes. Please introduce yourself.
Good evening, ma'am. I'm Lubna Nayas, final year PG from Saptagiri Medical College.
Welcome.
Be closer to the mic.
Yes, ma'am.
Shall we start?
Yes, ma'am.
Okay.
Who introduced the unit of verging power of a lens, the diopter? What is malignant glaucoma due to?
Aqueous misdirection.
What's DVEC?
Pass.
What term describes probability of detecting a true effect when it exists?
Pass.
What is the systemic association for this condition? The picture, look at the picture. Systemic association, a classical picture of Kansky.
Pass, no.
Okay. Okay. So the first question, diopter was introduced by Felix Monoyer, and the malignant glaucoma, you were right. And DVEC is descemetorexis without endothelial keratoplasty. Probability of detecting true effect is statistical power. Very important for the study design. And what is the systemic association? That is familial adenomatosis polyposis and congenital hypertrophy of retinal pigment epithelium. This is the classical picture we see, in Kansky. Okay, excellent.
So 1 correct, ma'am. Rest all pass.
Yes, yeah.
So plus 10 to them. So we are over with the 5 rounds of ma'am. So hand over to Dr. Prashop, sir.
Thank you, Shilpi.
Thank you. Prashop, sir. Dr. Prashop?
Sorry. Am I audible now?
Yes, you are audible.
Right, let's go ahead.
So the next team is Team Invincibles from Chaitanya Hospital.
Yes, ma'am. Yeah.
Please introduce.
Ma'am, I'm Joanna, second year resident.
I'm Ritu, second year resident.
Great. So I think you can go ahead.
So be closer to the mic, be louder.
Okay, ma'am.
The time starts now.
Right. Who was the first to introduce continuous curvilinear capsulorhexis?
Pass.
The drug with dosage used in Ozurdex infla.
Dexamethasone.
6 mg.
Most common adverse effect of topical interferon in OSSN.
Pass.
The stages of malignant diseases recorded as 1, 2, 3, 4. We say that the scale is
Continuous.
89-year-old female with trichiasis and tylosis. Name the finding indicated by the red arrows on the picture shown there.
Hornetron test buds.
Hornetron.
Right, let's look at the answers. So the first CCC was introduced by Gimbel and Newhan. Newhan is less known for it, but Dr. Howard Gimbel is famous. The dosage was wrong for the Ozurdex. I don't think we can give that. Can we, Dr. Shilpi? Because
we will give them +5, sir.
Okay.
For the dexamethasone.
Right.
Yeah.
Right. And the most common side effect, I think you passed. It is mild conjunctival congestion or follicular conjunctivitis. The stages is the stages of a malignant disease recorded as 1, 2, 3, and 4. It's an ordinal scale. It's not a continuous scale. That is wrong answer. It is not a Horner-Tranter spots. It is Herbert's pits, which are a sequelae of trachoma. You don't see them nowadays. We see them in textbooks really, but can get a few of them in very old patients.
Okay.
Right. So that's a wrong answer.
+5 and -10. So it totals to -5 to them.
Right. Good attempt.
Please mute yourself.
All right. Let's move to the next team.
The next team is Team Crazy Amsler from Government Hospitals, Kakinada. Team Crazy Amsler?
Hello.
Yes, please introduce yourself.
Hi, I am Krishnasri from RMC Kakinada. I am Harshavardhan, third year resident.
Hello, Team Crazy Amslers. Nice name. You ready?
Ready.
Please be louder, huh?
Yes.
Who was the first to introduce a slit lamp?
Stay back.
The drug of choice in capillary hemangioma in infants. Full form of CARES treatment used in keratoconus. I can't hear them. Name the sampling technique where a population is divided into homogeneous subgroups based on shared characteristics like
Stratified sampling.
50-year-old patient with recent onset
First one
photophobia
Woolstead, sir.
and
Second one
defective vision,
propranolol.
right eye. What is the most likely diagnosis?
Anterior uveitis.
Right. I did not hear them for the first three questions.
First one is Gulstein, sir.
Okay.
Second one.
Second one propranolol.
Third one.
Pass.
Okay.
Right. I think we can give them.
Yes.
Probably a connection issue. So Alvar Galspan introduced the slit lamp. Topical timolol or oral propranolol, either one can be given. They've answered propranolol, so we can give that. CARES was, I thought, fairly simple. but you decided to pass it, yes? It's
Yes.
corneal allogenic intrastromal ring segments. You did answer the sampling technique correctly. It's called stratified random sampling. And the last one you said anterior uveitis, but it's not. It's quite clearly posterior uveitis. In fact, it could be a panuveitis. It's an acute retinal necrosis that you can see on the picture. It's a clinical diagnosis. So unfortunately, you get -5.
So it's totals 2 plus 25. 3 correct and 1 wrong.
Well done.
Yes.
So let's move on to the next team. The next team is Dr. Manasi from SMBT, IMS and RC Nashik.
Hello, ma'am.
Hello.
Yes. I'm Dr. Mansi.
Right. I think be louder with your answers, closer to the mic, and we can begin.
Dr. Mansi, I can't hear you.
I cannot hear them either. Have they dropped off?
Hello.
Yes. Again, please introduce yourself so that we are sure whether we can hear you or not.
Sir, are we audible now?
No.
Are we audible now, sir?
Yes.
Yes.
Shall we start?
Yes, sir. Yes, ma'am.
Okay.
Which structure was strongly believed to be the seat of vision for centuries?
Pass.
Name a beta blocker eye drop that could be used in a patient with bronchial asthma.
Betaxolone.
The fluorescent stain for fungal keratitis.
Pass.
What are the measures of central tendency?
Mean, median, mode.
And name the fundus finding.
Rod spots.
Excellent. I think you
Want to attempt the
Any
first
other?
and third question?
Ma'am, yes, third one, since came on the computers.
Okay.
Pass.
Time's up. Let's see what are the answers.
Right. It was the lens that was thought to be the seat of vision for centuries. Then somebody thought it was the pineal gland, and we know in modern ophthalmology that both of these are not exactly the seat of vision. Name the beta blocker. You answered it correct. Yes, betaxolone, because it's a selective beta-1 blocker, does not inhibit beta-2 receptors in the lung and bronchi. The fluorescent stain, you did not answer, you passed it. It's calcofluor white for fungal keratitis. And the measures of central tendency, I think you answered right, mean, median, and mode. The fundus finding is rod spots. You got that blank on.
Yes.
Plus 30 to them.
Thank you, sir. Thank you, ma'am.
Very well done.
Okay, great. So the next team is Team Oro Serata from Arvind Eye Hospital, Coimbatore.
Hello, ma'am.
Good evening.
Hello. Good evening, ma'am.
I'm Dr. Manisha, Arvind Eye Hospital, Coimbatore.
I'm Dr. Kasturi, Arvind Eye Hospital, Coimbatore.
Okay.
Great. I must congratulate you for the great name. It's a catchy name.
Thank you, sir.
Thank you.
Shall we start?
Yes, sir.
Okay, be closer to the mic, be louder.
Yes, sir.
The first eye bank was established where and in which year?
Pass.
What is the role of flurbiprofen eye drops used just prior to cataract surgery?
There's
Third
mid
one, double track blocks.
faricimab.
Yeah.
Name the intravitreal drug that blocks the effect of both VEGF
Faricimab.
and angiotensin.
Faricimab.
It is
Increasing the sample size will
Decrease
what to the width of the confidence interval.
decrease the width.
Okay.
Capsular tension ring.
CT. Capsular tension.
I did not even answer the ask the
This
question.
malupnan.
You are not listening only.
My God.
They are not listening at all.
So I think you ran out of time. Therefore,
Third is faricimab.
Yes, you answered 2. The first you passed, second you didn't answer, third and fourth you answered, and fifth is passed. Okay?
let's look at the answers.
Yes.
Right. You passed the first question. The answer was the iBank in New York, established by Townley Patton in 1944. The second question, you did say midriasis, but you didn't say, I couldn't make out anything else. You were talking to each other. Did you make out anything, Dr. Shilpi?
No. It was passed from their end because they didn't answer.
Okay.
They just
Right.
jumped to the third question then.
All right. Third question, the answer was faricimab. That's the right answer. It blocks both VEGF-A and angiopoietin-2. And sample size, increasing the sample size will narrow the confidence interval. I think they have answered it correct.
Yes.
Make it more accurate. And you would be thankful that the time was up. Otherwise, you would have got -5. It's a balanced and artificial anterior chamber.
It's no way of like capsular tension ring or this ETR.
Yeah.
Okay.
So I think they ran out of time just before
Yes,
the
that's
answer.
what they said. Yes. So we are left with the 2 teams. They are not responding. So I'm making a last call to them. Team TVL from Tirunelveli Medical College, Tirunelveli. Are you there? If you are there, please let us know. And the last team is Team Iconic from Sarojini Devi Eye Hospital, Hyderabad.
Shilpi, have you mentioned the marks of the previous team?
Yeah, sorry. It's plus 20.
Okay, very well done.
Yes. So I think these 2 teams are not there. So we move on to the rapid fire round now. If by any chance, by the end of the rapid fire round, they log in, we'll take their rapid fire.
You mean the MCQ?
MCQ we are starting now. If by any chance, by the end of the MCQ, they log in, we will take their rapid fire round.
Right.
So they wouldn't have attended the previous MCQs, right? Still they are qualified?
Ma'am, we don't know whether they have attended or not because that is being recorded on the Kahoot platform.
Okay.
Yes.
So we move on to section 3. So I think there was a similar question in the previous rounds, but I don't think you're paying attention to any of the questions. So again, so this is a 30-year-old female presented with the following clinical findings in the right eye. So these are the clinical findings, and the intraocular pressure was 36 millimeters of mercury. The left eye was within normal limits. What is the probable diagnosis? So the choices are Axenfeld-Rieger syndrome. Is it Chandler's? Is it essential iris atrophy or neurofibromatosis? And your time starts now. Your time's up, and anterior segment dysgenesis with unilateral glaucoma goes more in favor of an iridocorneal endothelial syndrome. And there are 3 different components. So here you have the iris features are more predominant. You have this multiple stretch holes and correctopia. Can you go back to the previous slide?
Yes.
So you have multiple stretch holes and correctopia, and Chandler's is more of a corneal pathology where you have a hammered silver appearance. NF, you get Lish nodules. So, Axenfeld-Rieger, it's a bilateral condition. Next slide. So I like to ask questions related to trivia. So Joseph Pulitzer is famous for posthumously establishing the Pulitzer Prize. Which disease did he go blind by the age of 42? Choices are diabetic retinopathy, retinal detachment, corneal ulcer, or optic neuropathy. And your time starts now. So the answer is retinal detachment. And another interesting fact is even after he became blind, he went on to do a lot in his field and he became the father of modern journalism. And there's a lot he achieved even after he became blind.
Sharmila ma'am,
Yes?
we can't hear you.
Can you hear me now?
Yes.
Okay. So he became blind at the age of 42 due to retinal detachment. And even after he became blind, he achieved a lot in his field and he became the father of modern journalism. And that's another thing that we have to learn from them. Next slide. So a 30-year-old farmer presented this kind of a picture following a trivial trauma. A part which is missing in the question is he was actually treated with orokinosol, and this is a picture after orokinosol. So what is the diagnosis and ideal drug of choice? Is it acanthamoeba keratitis and is PHMB the drug of choice? Fungal keratitis, natamycin. Pythium keratitis and is linezolid the drug of choice? Bacterial keratitis, are you going to give fortified antibiotics for it? And your time starts now. So this actually Pythium keratitis, you can see the pinpoint infiltrates and tentacular projections, and you have an early limbal spread and peripheral gutter. The key is this patient was initially treated with orokinosol that's missing. That's why I mentioned that. So worsening after orokinosol because it doesn't have sterol and it doesn't respond to orokinosol. So linezolid is the drug of choice in Pythium keratitis. So you should always have the suspicion when you have a ring infiltrate and when you have a limbal spread and tentacular projections and reticular infiltrates. Next slide. Snellen's test types are based on the fact that two distant points can be visible or separate, or visible as separate only when they subtend at the nodal point of an eye at an angle of 5 minute. Is it B 3 minute, C 2 minute, or D 1 minute, which is the minimum angle of resolution? So your time's up. The minimum angle of resolution for a Snellen's test type is 1 minute, and it's pretty straightforward. We move on to the next question. This is the last question. Which of the following is a porous implant used in retinoblastoma? Is it hydroxyapatite, acrylic, B acrylic, C silicone, or D hydrogels? Which one of these is a porous implant used in retinoblastoma? Your time starts now. So the answer is hydroxyapatite. So we have porous implants or non-porous implants used in retinoblastoma. Porous implants are hydroxyapatite, and so it allows integration, fibrous growth, ingrowth, and integration into the orbit. Non-porous, they are cheaper, PMMA, but it's not as good as the porous implants. The answer here is hydroxyapatite.
So I think
And we come to the end of the questions for MCQs. Move over to Dr. Anita for the rapid fire.
No, ma'am.
I think
Alright.
we are
Yeah.
through. We are
Okay,
through.
yeah.
Quite immersive.
No, there were
Yeah.
two other teams, right? Like she said, they might join.
They have not joined.
Yeah, so they're not logging in, so we are not able to reach out. So I
Okay,
think
so
it's time for us to call it a day. So, friends, let us have all the quiz masters live with their videos on. We can have a small chat with few of the people who will be joining us on the Zoom platform from the private practitioner category. Till our backend team is ready with the people who could make it into the top 5 in the private practitioner category, we can have a small chat. So thank you, Prashobh, and thank you, Anita and Dr. Sharmila, for such wonderful quizzing. Rather,
thank you, sir. It was a
you
pleasure listening to all the questions.
Yeah, of course. Same here. Not only pleasure, it was giving me quite a complex. Frankly speaking, yeah,
Thank you for the
One
opportunity.
but
Always
one thing
love
that
to.
was a little different today is there were a lot of research methodology questions, and that was interesting.
Anita ma'am, uh, does the lead bias answer because they were forwarding me the articles and everything. So can we give the marks for the temporal answer also in that case?
Temporal, what was the actual question in that? Temporal bias is something like data collection is different. Like
The question was, ma'am, wait a minute.
The quizmaster's decision is final.
Bias which occurs due to duration of time between the detection of a disease and its usual clinical presentation and diagnosis. We
that's
have
the lead time bias. That
but
is
they
lead time
answered
bias.
is temporal and they
Temporal.
are
No.
Yeah.
A
My
temporal.
idea was it's a very specific term that lead time bias is a specific.
Yeah.
so it goes against them.
Okay.
So fine, we accept it's not, they are not going to get the marks. Fine. So I think no more questioning because those people are texting us lot many things. So we had to answer and get it corrected for their satisfaction. So thank you, Sai, for getting us so rapidly the private practitioner category. We have this numbers 1, 2, 3, 4, 5. Just look at the numbers, whoever are still watching us. If you are amongst them, just raise your hand so that we can promote you as a panelist and then we can have a small chat with the quiz masters, all these fine participants who are into the private practitioner, winning some prize money for today's episode as well. So please raise your hand and Sai, please do promote them. And I see few mentors also, Sai, kindly promote them. We can have a small chat with them. You can now stop sharing the screen. We can, till the people join, we can have. I see mentor Pratik Nishant there. Dr. Suprita as Suprita is. Dr. Swati Zawar is again a mentor. Please do get your videos on. Yeah, thank you, Dr. Swati, ma'am. Just get your audio as well, video on. Audio as well.
Yeah.
Hmm.
It was a wonderful quiz. I think for the first time there are a lot of questions on research methodology.
Yeah.
Yeah. So
And also on the various like various inventions were done, and a lot of they could not answer the who invented this or something like that.
no. So Dr.
The
Sharmila.
first question actually, first question of all the.
Thank you.
All the
Dr.
rounds.
Dr. Swati is a faculty in one of the medical colleges. Thank you, Dr. Swati.
Yeah.
Still,
Yeah, my team did
Thank you
well.
for your feedback, madam.
Yeah, thank you.
we have Dr. Pratik Nishant again, who is again a mentor from now RIO Patna. Previously, he was one amongst the contestants and rather participant in our quiz, and he had pocketed few thousands of rupees from me from Big Q team on various occasions. So Sharmila, you can just have a small chat with now a graduated mentor, a mentor who a postgraduate has graduated as a mentor, fielding his team for our Big Q.
Fantastic, sir. Did you win anything today, sir?
Good evening, ma'am. So
Good evening, Doctor.
I had been warned specifically by Dr. Bhavan Pillai sir that I was not supposed to participate in the quiz as a contestant. And being a mentor, definitely I follow the rules. I don't participate in the quizzes which my team would otherwise participate in. My students would participate in. But yes, it is a pleasure every time I log into Big Q and every time I get to hear the questions and the excitement of attempting the quiz and all the hard work that goes into the making and timing of those questions, I realize that. So kudos to all of you and thank you for this experience tonight.
Thank you so much for mentoring them and staying with us till the end, sir. It's
My
actually a
pleasure.
privilege for us.
My pleasure, ma'am.
Thank you. Thank you, Pratik. And now any other mentors are there with us? Sai, we have any of the finalists, rather the winners of today's episode? Have you promoted them?
I've tried to promote Dr. Q Mandal. He refused to come.
Ayo. Dr. Q, what happened? you are only interested in pocketing money. You need to come out and people should know who is this frequently always pocketing money from our brain teaser team. Anyone else?
He's left.
There were two teams from ROGO Chennai too.
And we are looking to have a chat with the mentors and
Yeah,
the practitioner category.
Any mentors there?
I think we are missing. Anyone else, Sai?
No, doctor.
No, okay. So I think it's quite a time. It's almost 9:10. We had been with the quizzing for last 1 hour 40 minutes. So it's time for us to wind up. So it was a wonderful session, season 5, fourth quarter final. We have culminated now. So almost 84 teams participated. Now we are left with 2 semi-finals and 1 finals. The first semi-final is going to be on 29th of May at 7 p.m. We will be shortly announcing the semi-finalist in a short while. You will get the mails and we will be also sharing on the WhatsApp group the teams which have made into. Remember, your performance in the preliminary rounds plus the performance in this quarter-final rounds all will be cumulatively put together, and based on that we will be deciding who are going to be the top 40 teams who will be playing the
20.
semi-finals में 2020
20 मतलब 10-10.
20 teams who will be playing into the semi-finals. So thank you. It's time for us to say bye-bye. My sincere most thanks once more to Sharmila, Dr. Prashobh and Dr. Anita for helping us out year after year for making this quiz a bigger platform, and people vie for it, rather, I should say. And we are really extremely proud to have people like you who is taking the platform of next level. Thank you once more, Sharmila, Anita, and Prashobh.
Thank you, sir. Thank you very much.
And of course,
Thank you.
Privileged
Thanks a
to
lot.
be part of it.
okay, thank you. Thank you.
Good night, sir.
Look forward to have you in the next season as well. So thank you, Sai, and your team for the wonderful job you have done. And of course, to Team His Highness for contributing and helping us out and standing financially so strong with us season after season. So friends, we'll be meeting again on 29th with first semi-finals. Till then, it is bye-bye from team at our end. Thank you. Bye-bye. Good night.
Thank you, sir. Good night.
Good night, sir.